Hello, my name's Stacey and I'm one of the midwives that works at the birthing centre in South Tyneside, but I also go between South Tyneside and Sunderland. And today we're going to go over the parent craft class for water birth and active birth. What is a water birth? So a water birth is where a woman gets into a pool of warm water during her labour and delivery. The woman would then deliver the baby into the warm water and the baby would be brought to the surface. After a water birth, you may deliver your placenta in the pool or you may get out and deliver it on dry land. There are some strict criteria of who can go into the water birth pool, and this will be discussed with you with your midwife in the hospital or with your community midwife. Some of the criteria that we look for is anyone who is booked at the midwifery-led birthing centre is eligible to go into the water birth pool. You have to be a low-risk pregnancy. Your pregnancy has to be more than 37 weeks when you go into spontaneous labour. You have to be a single pregnancy. Your baby has to be head down and that your baby is measuring a normal size. You are able to go into the water if you have had ruptured membranes and you go into spontaneous labour less than 24 hours following. If you also have GBS, it is eligible for you to have a water birth. Your BMI can also affect whether you are able to go in the pool, and your BMI has to be less than 35. This is just due to emergency procedures. If you are unsure about whether you fit this criteria, please discuss this with a midwife. So the pool acts as a really good pain relief and the water acts as a heat conductor, which helps to ease the pain of contractions, similar to if you were going to use your bath at home with period cramps or pains. It helps to improve the blood flow to the muscles and helps to transport the endorphins around the body. It also helps to transport what we call the love hormone, the oxytocin, and that helps to accelerate and shorten your labour. It also encourages you to birth actively, so this is to allow you to keep mobile with the use of the water for buoyancy, and it also has a reduction in pain as there is equal pressure to support all surfaces of your body. While you're in the pool, you are eligible to use gas and air. You can also have heat packs if needed. You are also able to use oral analgesia such as paracetamol and cocodamol. You can have diamorphine, but this would require a period of time outside of the pool. There are many benefits of water birth to the mother. The main benefit is that it acts as a pain relief during labour. This can help to increase your chance of a normal delivery and can shorten the first and second stage of labour. This is due to the relaxation method from the water, which helps to increase the flow of oxytocin around the body. You can also have a decreased blood loss and you're less likely to have a tear or need an episiotomy during your delivery. This method of birthing also promotes a hands-off approach, where your baby is delivered naturally into the water and you can bring the baby to the surface. This gives a lot of women the feeling of empowerment and a lot of satisfaction with their delivery. There are also many benefits of water birth to the baby. It is deemed to be a more gentler delivery and transition into life and helps to maintain the baby's temperature at birth. We tend to keep the water birth pool at a body temperature level, and this helps the baby adjust to life from outside of the womb and into the world. You tend to find that the babies, when they're born in the water birth pool, tend to be a lot more calmer and they don't cry as much at delivery. They're also more alert following skin to skin. You can have skin to skin while you're in the pool, and your midwife will discuss this with you, as well as discussing the method of delivery of your placenta. Skin to skin is really important because it helps to promote the oxytocin flow, and breastfeeding can also help the delivery of the placenta. It has been proven that delivering in a water birth pool can also reduce the risk of a baby needing admission to a special care baby unit. So the good thing about water birth is there's no disadvantages to mother or baby. One of the things that can happen is that the pool room can get very warm, so it is important if you do have the ability to bring a handheld fan. So due to the buoyancy of the water, you're able to adopt many different positions whilst in the birthing pool. You could, if you wanted to, practice these at home before you come in labour. The most common position that is often used in the pool is a kneeling or a squatting position, and this is usually done by holding on or leaning on the side of the pool. So you can also float on your back if you wanted to with the support of a pillow, and you can also float on your tummy with your head turned sideways. When you come in labour and you're in the pool, if you're unsure about any positions, please ask the midwife who is looking after you, who can advise and demonstrate. Your midwife's role during a water birth is the same as a normal delivery. We're here to support you through your labour and birth and help you get in and out of the pool, which may be required during your labour. We do lots of checks, ensuring that the temperature is the right temperature for when your baby is born. Like I said before, we keep it between a body temperature of 36.5 to 37.5, and we check this often. We also keep a check on your pulse and your blood pressure and your temperature, as being in the warm water can often increase your body temperature. We also monitor the baby with a sonic aid while you're in the water, and this is done every 15 minutes in the first stage of labour and every 5 minutes in the second. Your midwife may ask you to adjust your position slightly to enable us to monitor your baby effectively. We've also got some tips for a more relaxed birth, and this can be whether you're in the pool or whether you're out of the pool. It is important to keep yourself relaxed and calm during your labour, as this helps to increase the flow of oxytocin around your body. You may think of techniques such as relaxation or possibly hypnobirthing techniques, which may also help to keep you calm during your labour. We often tell you to have deep, slow breathing, and that tends to regulate your calmness in labour. You may also have looked into things such as massage, and that can be performed either by a birthing partner or your midwife if they are able to do that. You may also have things that trigger relaxation, so it's quite common for people to think of smells. So when you're at home before you go into labour, in the last couple of weeks of your pregnancy, you may find that smells like vanilla or lavender get you into a relaxed mood, and this can be brought with you when you're in labour on a small flannel or a towel which you can use in the room. It is important, obviously we do encourage you to eat little and keep yourself hydrated during labour, and keeping active, either walking around the room or the use of a birthing ball, is advocated at the birth centre. The most important person during your labour is yourself and your birthing partner, and they're going to be the main source of support for you. We're going to discuss a little bit about active birth as well. So if you didn't want to give birth in the water birth pool, we do recommend that women that come to the birth centre especially, we try and advocate active birth. And this is basically where you keep yourself upright and moving around during labour where possible and where comfortable. Gravity is one of the main factors that helps to progress your labour and helps to allow your baby to press on your cervix during the contractions and help you to dilate. However, for a lot of historical and cultural reasons, a lot of women now tend to go on the bed for labour and delivery, and we're trying to reverse that and keep people up and mobile. There are many benefits obviously to keeping active during birth, and these include reducing the risk of any medical interventions, because you're not spending a long time or long periods lying sort of semi-recumbent on the bed, which can affect your labour. It can also shorten your labour and make your labour less painful. Some women do say that they get a more satisfying labour because they're able to move around and get themselves in different positions using the bed, using their birthing partner, or using birthing balls. The woman's partner, your partner, often feels more involved if you use them during active birth, and there is some demonstrations on the slide of different positions that might be used during your birthing experience. Having an active birth means that you'll be free to move and walk around during labour and give birth in a position that you find most comfortable, like squatting or kneeling. You may also be able to use different birthing aids, such as a chair, a beanbag or birthing balls, which are provided at the birth centre. And there are some pictures to demonstrate, again, some different positions. So there's no proven way that we can use to start your labour yourself at home, but you may have heard different things from other family members and friends and your community midwife. There is no evidence that these things work, such as herbal supplements or even having intercourse. Having intercourse won't cause any harm, but you should avoid having intercourse if your waters have broken, because this may increase the risk of infection. Other methods aren't always supported by scientific evidence, include acupuncture, homeopathy, hot baths, castor oils and enemas. These are a lot of sort of tales that you might have been told by other family members that they've used in the past. One method that we can offer at the birthing centre or your community midwife can do at home is something called a membrane or a cervical sweep. These have been known that they may bring on labour, so they are offered to all low-risk women after 38 weeks. To carry out a membrane sweep, it involves an internal examination where we, if possible, do an examination where we can place the fingers inside of the cervix to stretch and sweep the membranes. The aim of this examination is to release the prostaglandins from the membranes around the baby, which help to get you into labour. You can arrange this, like I said, with your community midwife, or if you're planning on delivering at the birth centre, you can give us a call and we can arrange these for you. So we're just going to discuss some alternative therapies, as we know a lot of women who've been coming, especially to the birth centre, have mentioned that they've used these. So the first one we're going to discuss is called raspberry leaf tea. So you may have heard of that. Someone may have recommended that to you. And that is basically a herbal tea that has a number of benefits due to the high levels of vitamins, minerals and tannins that are contained in the supplement. It often comes in a tea bag, and you can buy these over the counter at your local supermarket or health food shop. It's really popular among young sort of mums to be, and it's thought that it can help to strengthen your uterus wall, and this potentially can obviously speed up your labour. There is no scientific evidence to say that this is accurate or this is true. It's just obviously what has been sort of passed on from woman to woman. It does show that it can contribute to more rhythmic contractions during your labour, and many people advise that you start drinking this at 32 weeks into your pregnancy, and this gives it a chance to build up in your body so that it can have an effect. You should stick to drinking one cup of tea a day, and then after a few weeks you may build this up to 2 cups and then 3. It's just so that it gives it a gradual build up to get in your system and obviously contribute to possibly helping your labour. Another one that seems to be quite common is something called Clary sage, and this is a flower and herb, and this is usually used as an essential oil. This is thought to stimulate the contractions or surges following a membrane sweep and help to induce labour. It also has a sedating effect, which potentially has a positive impact on reducing adrenaline and aids oxytocin production during labour. It's often recommended for usage after 38 weeks, and the way that you use this is you can add 5 to 10 drops to a bath of warm water. It does have a distinct smell, so many people do like to mix it with something different, such as a lavender oil. You can use the same method of inhalation by using it in a small bowl and just adding a few drops of it to some warm water. It has been known as well that you can massage 1 or 2 drops onto your bump and your lower back. You may wish to mix this with a carrier oil just to make it a little bit more spreadable and use it for a massaging technique. Another method which may have been spoken or you may have heard of is something called perineal massage, and this is basically where you prepare the perineum, making it more flexible to allow it to stretch and to deliver your baby easier during labour and delivery. This does involve massaging the area between your vagina and your bottom in the late stages of pregnancy, and this can be done with an unscented oil such as olive oil or a personal lubricant like KY jelly. We do advise that you avoid the use of any baby oil or Vaseline. This can obviously be performed by yourself, or if you wish, it can be performed by your partner. There is a little guide of how to perform, obviously, perineal massage. Basically, you place one or both thumbs on and just within the back of the wall of the vagina, resting one or both fingers on the buttocks, and you may prefer to use only one hand. Pressing down towards the back passage, gently massage by moving the thumb and forefinger together in an upwards and outwards rhythmic U or sling type movement. If you are going to do this, we do say to do this for 5 minutes if possible. So one of the most important things, and your community midwife will discuss this with you, is thinking about making a birth plan. So a birth plan is basically a record of what you wish or would like to happen during your labour. It's really important that obviously birth plans are personal to the individual, and that this is discussed and your wishes are discussed with your community midwife, and also dependent on any risk factors that you have during your pregnancy. So it's important that everything that you wish to happen is safe and practical for both yourself, your baby, and for the staff caring for you. You might find that it's a good idea to write this down, or often lots of pregnancy websites have templates that you can use to document obviously your wishes during labour. Sometimes it's not always possible to follow the birthing plan to exactly what you've requested, so it is important that you're flexible about what you would like to happen and what you're happy with to happen. Obviously, during your labour, if there's anything that we would need to do that was different to what you thought you might like or what you have requested, this will be discussed fully, and consent obviously would be gained. So the next slide shows a list of what we advise for you to bring to the hospital or to the birthing centre with you. There's some items for yourself, for baby, and also your partner. So these things will include enough nightwear or clothing for yourself, ensuring that you have enough sanitary products, enough clothes for baby, so vests, baby grows, hats and cardigans. We'll also recommend, if you are planning on bottle feeding, that you do provide your own artificial milk, and these obviously can be purchased in supermarkets, and bring those with you. There's also some things that you may want to bring with you, such as a playlist, a Bluetooth speakers, or any candles or lights that you wish to have during your labour. So thank you for watching. If you do have any questions, please don't hesitate to contact the birthing centre or the maternity unit that you're booked at if you've got any questions about water birth or active birth, and the midwives would be happy to discuss this with you.